People accessing our service often describe some of the challenges they face with memory and concentration during and after cancer treatment. They talk about forgetting dates, phone numbers, the names they'd normally remember, or struggle to follow conversation, or taking longer to carry out tasks. Our pilot project, funded by the Transforming Care After Treatment programme, looked at ways to help people manage these memory and concentration changes. We've been running our programme since early 2016, providing information on what memory and attention is and how these difficulties can be overcome. After cancer treatment, some people notice changes in their memory, concentration and the way they think. Women with breast cancer were the first to report these problems, which they linked to their chemotherapy treatment. They called the changes chemobrain, or sometimes chemofog, but it's not clear what causes this, so calling it chemobrain may not be accurate. Cancer-related cognitive changes and mild cognitive impairment are other terms we use, but cognitive simply means thinking. Most people who have cognitive changes are able to do everyday things, but they may notice that they aren't able to do some things quite as well as they did before they had cancer. The changes are often mild and very subtle. They aren't progressive and do improve over time, but if you have them, they can impact your everyday life. And this can be quite frightening for some people.
I had my second diagnosis with cancer 2016. My treatment finished in June, and by the end of June I started realising that my memory was actually going. Couldn't remember going into shops, what I was going for. I'd get into the car to drive, could not remember where I was going, had to pull in. Had no idea what was happening. Forgot my grandchildren's names. Had to start calling them pet and dear. It just got to a stage where I knew there was something seriously wrong, but I didn't know what it was.
I was having problems for like 2 years, but they said I had something else that wasn't really anything to bother about, but I knew there was something going wrong. And then they said they would cross the T and dot the I's because everything was fine. And then went up to see a urology guy, and he just says, "Oh, it's cancer." And my world just stopped. I've got a really, really good memory. I can remember things from when I was a kid. My hill walk, and I can remember every single day out, who I was with, what the weather was like, how long it took us, the journey up, the journey back. I could recall it all. And I started forgetting like simple names of the hills, so I would just say, "Oh, the hill in that place." And then it progressed from there. Like I would say, a duck. I would be talking away and I would think, right, I'm going to say duck, I'm going to say duck, and then it would just go. And I had no idea, but I would carry on talking. And then I'd always be thinking, what was that word that was? So the next 3 minutes of talking was just waffling, because I would remember, "Oh, duck, that's what it is." And I would say duck and people would go, "What are you talking about?" I says, "That was a word I forgot." And then I would be trying to explain myself. So every day it was becoming more difficult to understand.
So knowing more about what's going on can be extremely helpful in managing this. The changes can come and go, but how much you notice them seems to depend on what you're doing, and perhaps even more so when you're trying to do more than one thing at a time.
A lot of different strategies and coping mechanisms we have put into my lifestyle. I'm not saying that I'll ever be the same. I gave up my job because although I did the same job since 2002, it was very difficult and stressful for me to go back in and look at a computer. I had to work with 2 different computers, 2 different systems. I would look at one and totally forget if I changed the screen, what on earth to do on that. But it got more and more stressful, so I decided you have to take that away. You can't have that stress in your life. Because some days it is, I find things quite stressful. But most of the time now, knowing what's the matter with me and knowing that there is help out there, I really do feel that I'm coping.
There's been a lot of research in recent years but so far it hasn't clearly shown whether chemotherapy causes these thoughts and memory changes. Researchers recently used MRI scans to look into whether the brain works differently in people who've had chemotherapy. One of the earliest studies was carried out by Professor Ferguson on identical twins. Following surgery for breast cancer, one twin was treated with chemotherapy and hormonal therapy. The other wasn't. They were given a test which required paying attention, remembering the information, and having a good reaction time. Although their actual performance was the same, the twin who was treated with chemotherapy had a lot more activity in their brain. This extra brain activity suggests that the brain has to work a lot harder to complete these tasks, which previously they would have carried out with ease.
It got to a stage where I didn't bother with stop meeting with friends because a group of us, I couldn't keep up with the conversation. I couldn't remember. The subject had changed and I still was on the previous subject. Somebody would say something and my mind went a total blank, had no idea what they were talking about. And yet I'd been involved, what I thought was being involved in the conversation.
I do believe that they expect it to come back. Nobody's told me that, but the surgeon's sidekick boy kind of cocked his head in the usual cancer way and said, "Oh, I'm really sorry." And that's why I really struggle with everyday life, because I still hear his voice saying, "I'm really sorry," and I've just been moving on.
It really got to a stage, I didn't know what I was going to do with myself until I got to that programme. I couldn't cope. It was the most horrendous time of my life. Cancer had nothing on those 3 months that I went through. It was a nightmare.
Patient stories tell us that these memory and concentration changes are often invisible to other people. One of the main challenges after finishing treatment is that everyone expects you to be back to normal. This may include your employer, but it might not be that easy. People around you are willing you on, but you might not be ready, as adjusting emotionally just takes time.
Tell them definitely to go. These people, they're not put here like to help you. They're more than that. And if you walk out the room and you don't use information, then you won't regain your confidence. And I have got the confidence now to sit here and talk to you.
Throughout the programme, I did a lot of crying. We were all exactly the same. So it meant that the relief, I wasn't bubbling because I was upset, I was bubbling because the relief of knowing that I wasn't suffering from dementia was unbelievable.
Like put post-its on things to, like the reminders, triggers for your mind. And mine's, as I say, everything pointed to slowing down and regaining my confidence. And
they gave us like homework sheets to take away for us to read. We did problem solving. We were able to talk about our experiences and all the stupid, silly things we had done. I think every one of us came away with new coping strategies. Absolute silly things like not remembering where I was going. I now use a sat-nav every time. That way, I know exactly where I'm going, and the kind lady tells me at the end of it, I've reached my destination. I used to have one pad and pen sitting, and if I remembered something, I'd put it down, mark it down. But I'd be up the stairs, and by the time I get down the stairs trying to remember something, I'd forgotten it. So what I did was put a pad and pencil in every room, including the bathroom. And that meant that I had 5 notepads. I'd collate them all at the end of the week, and I had my shopping list. A lot of things I didn't discuss with the family because I felt that I'd have done something through the day if they weren't there, and I'd think, what a twit you are. But it was the fact that other people sharing their experiences, we were all so open, and we did laugh. We laughed a lot. It gave me my confidence back. I felt that I'm going to be able to cope.
Yeah, I got back out with my friends and started back on the hills. I completed the Munros in under 2.5 years. I know now that I'm much, much slower after my treatment and after get my weight gain with the treatment, but you're still here. You can still do it, and if you put yourself out there, there's lots of miles I can still do, there's lots of hills I can still do, and doing them at night and watching stars from 3,500 feet, you're thinking, God, it's just something really, really special. But now I walk right out and I've got a confidence just standing over a 2,000 foot drop and just looking straight down. And it's not a, like, I want to die, I would jump off. It's more, I can do this, you know what I mean? And I can see what a bird can see. It feels good. It feels really invigorating. It feels exciting. It feels a joy to be alive. The new confidence, the new me. I just know I'll get there. You know what I mean? It's just, I've just got to keep going and keep trying. And as long as you keep trying, then you're giving yourself a fighting chance.
The adjustment to the emotional and mental side of things after treatment is also invisible to others. They may not understand that you are feeling more emotional or see the struggles with your concentration. That's why the more people who know about these memory and concentration changes, the more they'll understand, the easier it will be for you to adjust and to do this in your own time.